often, as I understand it, you guys are in charge of where NHS money gets spent within the county. But at the moment, I would guess the prime driver of that is, spend it all as far as possible on dealing with the pandemic.
Oh, absolutely. Our main focus has been really helping to coordinate services to make sure that we are aligning general practice, the hospitals, the community services, mental health services, making sure that we can facilitate as much as possible to create the right environment, the right health service to be able to respond to this crisis for patients.
And you're in general practice, sort of with your day job hat on, if I can put it like that. I've been speaking to some GP friends of mine, and they've been telling me that, weirdly, by and large, at the moment, GPs' surgeries are kind of quiet. Is that your experience?
Yes, it's the experience of all of us actually across the county, very weirdly quiet. And we're concerned really that patients aren't coming forward with significant health needs that they should do. We are, of course, working in a different way. I can describe that for you if you like, but we are very much open for business as usual. The front door might be not open in terms of we're not asking people to just turn up at the surgery, but our virtual door is very much open with a different way of talking to patients and triaging and assessing patients.
Yeah. Do you have a particular group of society that you're concerned for during this kind of pandemic to one side? I know that some parents got texts over the weekend saying don't let concerns over COVID-19 stop you from contacting medical services. Is it fair to say that children are one of that group, that it could be at risk if people aren't taking them to hospitals?
Yes, absolutely. So many of us sent texts out over the weekends just because of our concern really about children not being brought for assessment in the usual way. And our message has been, if you're worried about a child, it could be coronavirus, it may not be. And there are lots of other illnesses that continue through our society. So if you've got a child who is sick that you're worried about, please don't hesitate to contact us in the normal way. We're open. We'll absolutely assess you. And if it's out of hours, of course, then 111 or 999 if it's very urgent. But don't delay bringing a sick child to see us.
It sometimes feels like it's almost an actuarial decision about treatment at the moment, whether you consider the risk to be worth taking, and I wonder whether that's something that you can help advise people about. Here's an example from my own life. Our 12-month-old son, he's going to be 12 months old on Sunday. He's got his jabs next Thursday. And of course, we're going to take him in for those injections because we think that's worth it. But there'll be some people who think, well, at this time, could I delay that by a couple of months? Could I delay it by 6 months? Is that a decision worth taking? GPs, or is there somebody there who can help people make those kind of decisions in their own life?
So we're absolutely helping people make those sort of decisions on a daily basis, really. So we absolutely want children to be brought in for immunisation. We absolutely need to prevent other epidemics of other diseases are incredibly important. And we will bring people into the surgery when we feel that it's the right thing to do. And we've tried to make our surgeries as safe as possible. So there's not very many people going through. We're allocating specific times for people to come. So if we ask you to come to the surgery, it's because we consider it safe for you to come, and because we consider that that's a procedure or an injection or a blood test that really can't wait and should happen. So you need to be guided by your GPs because we're making these assessments for you all of the time.